Hello, I'm Brianna. I'm going to be doing a catheter Foley today. So I have an order from the doctor. I'm going to make sure I have the right patient. And I have Mrs. Smith here. Ms. Smith, can you please confirm your name and your birth date? And there's no wristband on her, but theoretically there will be. Okay, so I'm going to first start out with doing some peri-care. So I'm going to wash my hands, throw some gloves on. Maybe. Throw my gloves on. And then I'm gonna do my, that's unfortunate. At least they weren't sterile. Do my peri-care. And I will have an assistant on this one just because it is a sterile procedure. We have to have someone non-sterile to help us with the non-sterile stuff. There we go. Got it on without breaking it. Okay. Okay, peri-care has been done. I'm not gonna expose her that much. Then I'll expose her this way. I'll lift her legs up so she's spread eagle for the peri-care. Of course, there'll be privacy everywhere. Okay, and now I'm gonna get my sterile field ready. I'm gonna get rid of these gloves. I'm gonna wash my hands before I do this, and then I like to put on a pair of gloves before I put on sterile gloves. I don't like when latex touches me, and it just helps me out a little bit. So I'm gonna open up my catheter stuff. I don't need this. And then I have the label for what RN inserted it. I'm gonna throw that away. Okay, and then when I start doing this, I'm gonna grab this little fold here, and I'm gonna go to the side with it. And I have an inch of room I can grab on these pieces of sterile paper over here. I'm just gonna take my time with this. I don't want to break sterile field before I've even started. Then I need to go get a new one. Okay, and then this one, I'm gonna pull it like this and then grab my corner here. Okay, I'm gonna grab this. I don't need these sterile gloves. We have some of our own. Okay, and then I will be using these guys, so I'm just gonna grab them and move them out of the way because these aren't gonna be sterile. I'm gonna put one down. In case there's a mess. Okay, and now I'm gonna get my sterile gloves on. I'm gonna move this guy out of the way, we don't need him. Okay. That's theoretically the trash can. And theoretically, all of this will be brand new. None of it'll be open, just like the gloves were. Because if not, it's not sterile. Okay. I'm not gonna open it into the sterile field because that would make it not sterile anymore. This first one, I'm gonna pinch this part that's gonna touch my hands and slide my hand into it. While also being very careful, taking my time. And then I'm gonna keep grabbing this and pull it down. Okay. And then this one, since sterile can touch sterile, I'm gonna grab this part. Then slide my hand in this way.
Okay, I think I'm ready.
Okay. So now that we got to this point, I'm gonna keep my sterile hands in my sterile field. So I'm gonna grab this, I'm gonna pinch it, and I'm gonna bring it here. And this is where my assistant or partner would help me move her legs so that we can get them in the right position. So I only need one of these. I'm gonna toss it. And I need this guy. I'm gonna toss the guys we don't need. And I will be using lube, but not this one. I'm not sure where the other one went, but we will need some lube. We do not need this guy. We do need this one. I'm gonna pinch this and toss it. Okay. Now I'm gonna get this part ready. I'm gonna unravel it a little bit, and then I'm gonna pinch. I'm not sure if I put it in the box. Okay, and we're gonna toss that. We don't need that part anymore. Okay. And then so for this part, I'm just gonna get this part ready. Just makes it a little bit easier when we get the whole thing in. I'm gonna make sure there's no air bubbles first though. Okay. Now theoretically I would put some lube on. I don't have it over here at this time, but there will be lube on here. Okay, and then this is where I'm gonna break the sterile. I'm gonna hold this one here. And then I would open these before I break the sterile field. So these will be opened. And then I'm gonna break the sterile field. I'm gonna pull them apart. This first one is gonna go on this side, and then I'm gonna drop it. And then this one is gonna go on this side, and then I'm gonna drop it. And this last one is gonna go down the middle, and I'm gonna drop it. Okay. I'm gonna tell her, can you cough for me so that I know where to go? Okay. You ready? You're gonna feel some pressure. 1, 2, 3. And I won't touch the patient with this sterile hand, my right hand. Theoretically, this will go in a lot easier because I will have lube. But we're gonna go in until we get some urine out, and then we're gonna go a couple inches more. Okay, so theoretically we got some urine, so I went a couple more, and then we're gonna take this here, and I'm gonna hold this here because it's not going into the patient anymore, so it's okay if it's not sterile. I'm gonna inflate the balloon with the syringe, and the balloon will tell you how much to inflate it with. It can't be inflated with the mannequins, but the balloon will tell you how big it is, and that's how much milliliters of sterile water you're gonna put into it. And then you're just gonna detach it from here and then get rid of it. We don't need it anymore. Get rid of this, we don't need it anymore. And the balloon is filled, so I'm gonna take this out. I'm gonna tape this here. Theoretically, I'll have a piece of tape. We're gonna tape it to her leg. And then I will put this onto an immobile part of the bed. Let her know about bed safety, getting up and walking, all of those things before I leave. We're gonna clean this up a little bit. Okay. All right. And then for charting, I'm going to chart how big the catheter is. It is a 12 FRCH, and then I filled it with 5 milliliters of sterile water because that's what it says the balloon size is on there. I'm gonna chart how well it was tolerated. I'm gonna cover her up for a little bit. I'm gonna chart how well it was tolerated. I'm gonna chart what color the urine was, what it looked like coming out, how clear it was. I'm gonna chart the time and the date and my name, credentials.
Have you had any injury, surgery?
I think that's it. I think that's.
No? Okay.
Sorry.
Is there a certain hospital that you
I think
prefer?
that's all I'm gonna chart. And then, so it's been a couple days. I'm gonna get rid of these gloves because they got latex all over them, latex powder.
To insert?
Okay, it's been a few days. I have an order to take the catheter out. So I'm gonna come in. I'm gonna make sure this is the correct patient. Hi, I'm here to take your catheter out. Can you confirm your name and date of birth? She confirms it. So we're gonna pull it back, and then I will wash my hands, have some gloves on, and I will take a syringe. Theoretically, this will not be filled. I will take my syringe and I will make sure that there is no water in the balloon.
My partner will help you. She'll give you water, so you'll be taking sips as I tell you so you can.
Okay, and I'm gonna do it twice just to make sure. I don't want to make the patient uncomfortable for any reason. Okay, and then we're gonna take our.
Are you feeling okay? Ready?
We're gonna take our napkin here, and I'm gonna let her know that this might be a little bit uncomfortable, but it should not hurt. And we'll pull it out on 3. 1, 2, 3. And then it's out. There may be a little bit of urine, so I would probably put a chuck or a puppy pad down, just in case.
Are you feeling okay?
And then we're gonna get rid of all of this.
Sit.
I'm gonna chart how she tolerated it. I'm gonna chart urine color, all of that stuff, what time and date. Yes. And I'm gonna make sure that the bed is locked low, guardrails up, call light right next to her, within reach, if you will. And then I'm gonna backtrack a little bit. Before I start the procedure, I'm gonna make sure she's not allergic to iodine, betadine, or shellfish. And that's how I would put in a Foley catheter.